Hello, everyone. Thank you for watching this session today. So, today's guest speaker is Dr. Ahmed. A very warm welcome to you, Doctor.
How are you? Yes. Hi.
Yes. To introduce Dr. Ahmed is a visionary and an innovative healthcare strategist. Along with that, Doctor has done his MBBA in hospital management. Along with that, Doctor is also an emotional intelligence expert specialized in driving organization change through empathetic leadership. So, a very warm welcome to you, Doctor, once again. You can take forward the conversation from here.
Thank you, Kanika, and I'm really happy to be a guest speaker in your platform. And the first, I know that this session is about nephrology Egyptian board, the steps that you need to make this happen. Egyptian full board of nephrology divided on three parts. The first part and second part depends on the written exams, and the third part is the practical part. It depends on when you decide to join the Egyptian board. It divides to 4 years. The first 2 years is about to take internal medicine, not nephrology, and the successive 2 years is about nephrology. There is 3 steps after the internal medicine depart. The first one and second one is a written exam, about 300 question MCQs. And the third one is a practical stations, 10 stations on as the normal of when you are taking a master of internal medicine. Will be in real cases, and made in one of the hospitals that the Egyptian board decided to make the exam in. Then after you pass the first 2 years of internal medicine, you will join the nephrology Egyptian board, and you'll start nephrology medicine on cases, and that will last for 2 years. After the first year, you will take the first exam. Then after at the end of the second year of nephrology, you will pass. You will have to pass 2 exams. The first one is written, and the second one will be on real cases and dialysis machines and some department of transplantation, and it will be overwhelming because they will ask you everything about nephrology. It's very hard to pass. You have to study well, and you should join the Egyptian board study that they're making along the years, a lot of seminars, and they're making sessions of training, and you can take from 4 to 5 years to end this Egyptian nephrology board. And other boards in Egyptian board will take between 4 years up to 6 years, according to the specialty. I think you have some information about the Egyptian syndicate and how you can join it. Egyptian syndicate required a lot of things to make it so you can join it. At the end, at the first, you will make a permission. You will make a request to the Egyptian syndicate that you want to join the Egyptian board, and after that, it will be passing with a security check for you. It lasts from 1 month up to 6 months. After that, when you will be accepted, you will join immediately to the program. If you have questions to ask me, so I'm here to glad to hear you.
Doctor, basically, like when we were researching about how to become like if any doctor who wants to go to Egypt and become a nephrologist, it was like mentioned on the Google that anyone who has written USMLE can also come and like go for IMG pathway for Egypt. Is it true, doctor?
Yes, you can join. There are no specific rules to join the Egyptian syndicate so you can work in Egypt. It depends on every student and every situation. They are studying every situation about it from what are the degrees do you have, if you have USMLE, or if you have PLAB, if you have any other certificates, it will be considered. The security check is very important here in Egypt. They are making a security check. This security check usually delays from 1 month to up to 6 months, according to every case. Maybe in the next weeks, I will try to bring all the instructions from the Egyptian syndicate for foreigners to how they can join and how much they can pay, and if there any requirements other than we are talking about, I will bring that to you, inshallah.
Okay. Okay, doctor. So, doctor, would you like to share your screen and would like to continue speaking about the hospital management and the soft skill which is needed for the doctors?
Yes, of course. Wait. Many of us through the journey of from young doctors to be a professional one, we are forgetting that there are some skills that really needed in healthcare according to become a professional. These skills really is very important as the medical knowledge and the technical knowledge. And I see a lot of students or a lot of my young colleagues, they are struggling a lot in these soft skills. The soft skills are really crucial for young doctors to starting their career. And we can't forget that medical knowledge and technical skills, they are very important, but not enough to be successful in healthcare. Strong interpersonal skills are really needed to communicate with patients and with your colleagues at your facility. Mastering these skills really will be a significant, and maybe it will be the difference between you and other doctor, that you can master these skills. Building some relationships with your colleagues and patients really can lead to a greater job satisfaction and career advancement. What are the soft skills? This is the question that many of us would wonder to ask. It's person qualities and interpersonal abilities for effective communication and collaboration and problem solving. Soft skills refer always to the personal qualities, the interpersonal abilities that you have. These skills including communication, and which is the very important and the most crucial one between these skills, and collaboration, problem solving, adaptability, leadership, and the last one is emotional intelligence, which is very important also.